You're confused. DCFS just knocked on your door and told you some things that you didn't want to hear. At this point, we have to remove your children. And you're like, who are they? What makes them think they can come in my house and take my kids? I understand. The first thought you have is, oh, no, they're not, because everything we stand for is protecting our children. Well, historically, they had rights for animals before they had rights for children. And as sad as it sounds, so many of our children were being abused in a lot of situations that may not be going on in your home, or it may be going on in your home. I'm not really sure why they came to your house. I'm not sure what it sounds like, but their role was shaped by children being abused in the home, sexually, physically, spiritually, financially, educationally, and medically. So these kids are not able to have doctor's appointments. You don't take them to the doctor every 6 months for dental every 6 months. You're not making their doctor's appointment. You keep rescheduling. You have a special need kid at home and you're not getting the services that's available to help that child thrive. Those are some medical neglect things. So, and then physical. I don't know about you all, but I come from the era I would get popped, smacked, everything when I done something wrong. That's how my mother handled me, because that's how it was handled from her mother and then her mother and then her mother. Well, we know now when kids are being hit because they've done something wrong, they learn to hit when people do things they don't like. It's a vicious cycle. So, and then you have children that are emotionally neglected. You may be going through addiction. You may drink every day. You may not see it as an addiction. You might be smoking weed. Oh my God, it's legal. I can smoke. Listen, if you're using drugs and alcohol to cope with day-to-day life and just to function, to eat, to sleep, or to feel whole, you may want to get a mental health assessment. Not a bad thing. I'm Toyia Conway-Hampton. I am sober now 27 years, only because I did what I needed to do in regards to recovery to see that, okay, I am imbalanced in a lot of ways, but I don't have to drink and I don't have to use no matter what. So because of us special parents with all of these challenges, the child welfare gets involved. And I don't believe, so often I hear, they just want my kids. They want a check. I disagree with that. I do. I've had my children taken away, placed in care. I am a community person. The treatment I received wasn't exactly like luxury. However, I realized what part I played in it. I did something different, and now I'm on the other side, 27 years. So those are some things that kind of shaped the department as a whole to come in, and it's a nudge. You might get a nudge from a judge, or you might get a nudge from your social worker. It depends. So there, and we'll talk about that later on in another episode. What the federal laws and regulations is, child welfare is the federal government. So if they knock on your door, people say, I don't have to let you in if I don't want to. I don't have to. The more you push back in the beginning, they can't come and make sure the kids are safe and then move on. If you're doing nothing wrong, yes, it feels violating. But if you're doing nothing wrong, I want to encourage you to still allow them to come in and do their investigation. Yes, they're going in your cabinets. Yes, they're going in your closets. Yes, they're going in your RV. Yes, they're going in lock cab. They are. They're going to do all of that because it's part of protocol to make sure the children are safe. They've taken on this position from the federal government to make sure that our children are safe and our care. How do they collaborate with other people? So once your family is involved with child welfare, they have a couple ways that they support community agencies. Some of them get a chance to bid and be directly referred from the department, like this is an extension from this program is considered the aftercare piece and all those things. They'll send you over here, which is intervention. Once they step in, there's a prevention and there's an intervention. So the difference between the two is if something's going on, they're going to send you to the program to intervene. What else can happen after that? The prevention is if they see that a family may not be involved in child welfare or they can possibly be, then they'll send you to an agency that have prevention strategies. If this mother knew that whooping her child would get her in child welfare, but she don't know any other parenting skills because she learned that from her mom, then that would be a prevention method. Bringing services to junior high school teenagers is a prevention measure. So child welfare gets in and they collaborate with a lot of community stakeholders. So we here at Two Lifestyles, we do drug testing for them. We do parenting classes, anger management, sexual abuse awareness, youth supportive services, and domestic violence for victims and for batterers. So we cover a lot of classes on our campus. And if you or someone you know could benefit from those services, please click the link below, reach out to our company, and let us know how we can help you.